And when we go to our clinical, never shake a linen. Okay? We don't shake. We just coming to. All right. This is your patient. This is how your patient look like, right? Okay. So, all right. So these are the curtains. Just like at the hospital, we have a curtain to pull before we touch the patient. We gotta make it sure that we're going to close the curtain. That is for privacy. Okay? We don't want to expose themselves. Yeah? Okay. So in your state exam, if you use this cubicle, that is your safe. Pretending. It's a pretending. Pretend. Okay? But you have to pay attention to the examiner which curtain you're going to close. Okay? But in the clinical side, in the real world, we will really cover the patient well. Okay? Alright. So make it sure. This is how we begin our state test. So whatever I do, that's how you're going to do. You're not going to cut. You're not just going to go, how are you doing? Hey, no. Okay, that's not what you're going to do. Okay, we're ready? Okay. I wash my hands before I enter the room. Knock, knock. May I come in? Good morning. My name is Anna. I'm your CNA for today. May I check your ID, ma'am? Your name is Grace Lee. Mrs. Lee, I'm here to help you to change your gown. I'm going to get my supplies. I will be right back. Here is your call. Mrs. Lee, I'm back with my supplies. I'm going to close your curtain for your privacy so that they can see. I'm going to lock your bed for safety and raise your bed to my comfort. Can I have your call light? Right. Mrs. Lee, we're going, you're gonna help me. Yeah? I'm going to start removing your gown from your strong side. In the state exam, you're not going to put your gloves, but in the real world, we do. Okay? And your weak side. Okay. Miss Lee, can you hold this for me? So you're going to lift this one and remove this. Okay? Everybody see it? I'm going to put this one in the soil bin. Soil bin. I sanitize my hand. Okay. Now, Mrs. Lee, I'm going now to put your clean clothes or new clothes. We're gonna start with your weak arm. So here, make sure you know the opening. Yeah? Make sure you're gonna know where's the left and the right for the clothes of the patient. So you're going to put inside this one. So you're going to take the arm of the patient. Alright, Mrs. Lee, at the count of 3. So you're gonna have the shoulder. Okay, at the count of 3, I'm going to sit you up. You're gonna help me, okay? Alright, 1, 2, 3. Can you help me put you? Alright, okay? Alright, Mrs. Lee, at the count of 3, I'm going to lay back down. 1, 2, 3. Okay, Mrs. Lee, we are done for today. Put this in the soft bed. Put your bed in the lowest position. Here is your collar. See you later. Open the curtain. Wash my hands. Document skills complete. Okay? That's not how you do in your like this. It's slow. You're gonna have the speed. Okay? Today we're gonna do the 1 mile an hour. Right? When you have your state test, you have to do 100 miles an hour. Okay? Like, I wash my hands before I turn the room. Knock, knock, may I come in? Good morning. My name is Gabby. I'm your CNA for today. May I check your ID band? Your name is, because you have 5 skills to perform. Okay? The state is the one who's going to make your test, not us. Not us. They already ready made. On the test date, they will give you the whatever you're going to perform. 5 out of 22. So the 22 skills, make sure that we have to remember them. We know how to do it. Is that okay? That's how you're gonna perform in the state test. And that is also how you're going to change the patient. You're going to start removing whatever I'm teaching you here, you're not going to do on your own. You're not going to remove from the weak side. You remove from the strong side. Hey, Ranjo, would you mind to get the IV, please? No, the IV. No, over there. Inside. Would you like to remove the IV? You. Can you remove that too?
That's true, Miss William. What if the patient can't sit up by themselves or can't help you?
Huh?
What
We
if-
do.
What if like they're
Oh,
strong
you can do
like
side to side.
You need strength.
Yeah, right. Because I have to perform too, because there are some patients who have IV and there are some questions coming from the state. Okay? The same thing. We
Chance. Is that
stand. Let's show her the pole. Okay, the same thing. The same thing. Where do we start removing? Where do we the stronger side? So the IB, we consider that as a weak side. Okay? Okay, make it sure now. So we're going to remove from the stronger side. Can you help me? And then you're going to cover them. Okay, so then we're going to take this one. Make sure you're gonna cover the patient. Yeah? Okay, so then we're going to go there. Okay, so hang up. So now we're going to remove this one, but we're not going to lower this. Okay?
It's gonna fit. It's gonna fit.
Yeah, it fits. Right? Okay. Then where do we begin again? The weak side. So we're going to grab again the pole. Gonna go this way. See that? Okay. So we're going to do here. you, what if the patient unable to sit? That is a good start to do too. All right, Mrs. Lee. Since you have this strong arm there, you're going to grab the rails when I turn you. Okay? All right. So turning. If the patient able to help to cross their legs, you're gonna cross them. Okay? Already. So, things to remember. You're gonna have a good body mechanics, right? So that you're not going to hurt your back. You're not going to do this one. You're not going to do this. But one leg forward and one leg behind. Okay? So you're gonna hold the shoulder and the hips. Do not go there. Okay? Always on the shoulder and on the hip. At the count of 3, I'm going to turn you on that side. Ready? 1, 2, 3. That makes sense? Okay. So you're gonna put like this to that. Alright, Mrs. Lee, you can come back. And I'm going to turn you now towards my side. Okay? 1, 2, 3. Okay? You can help me with that. Already. Okay? That makes sense? Yeah? Patient unable to sit, you have another alternative position. Sometimes, or most majority of our patients, they have a bed sheet so that you can pull that sheet back and forth. Like, let me see. I don't have
Bed
a
bag.
book. Can you get me just the blanket?
Yeah,
Let's say this is a draw sheet, but actually this is called your bed bath blanket. See, it's rough, so they call it bed bath blanket. This is compared to this linen, yeah? This is soft, this is rough. So we're gonna use this one to like a towel, serve as a towel, and to cover the patient when we shower them. So you can do turning the patient. Alright, so we're going to talk about how we position the patient. If you are by yourself, of course the bed is high, right? On your comfort. So patient is not skinny like her, a little bit bigger, maybe heavier, or a little bit, maybe a 200 or 250, okay? Or even 300. If the patient able to help you to turn, you can do it, okay? By using this one. All right, Mr. Lee, I'm going to turn you towards me at the count of 3. 1, 2, 3. This is a log rolling. This is called log, L-O-G. We turn the body of the patient as one fluid. Okay? This is called your log rolling. So you can go back now. You can go into the other side and pull again the patient. Okay? Try. Sorry, dear. Okay, so you got it? Okay, now we're going to exercise the patient because they are one side of the body is affected with stroke. So we're going to exercise them. The CNA that exercise them are called RNA, the restorative nurse assistant. But they ask us so that after they've done those RNA or the physical therapies or the OT therapies, we reinforce, especially when the patient is awake. So we're gonna tell them, Miss Lee, you have your therapy, right? And the RNA does the two. So you're gonna have to do while you are awake, so that they do more to prevent contracture, and their muscle is not becoming smaller in size. Okay. So now we're going to do now the range of motion. Okay, they call it range of motion. We're going to help them exercise so that their joints is not going to contract, and for proper blood circulation too. Okay? Already. A little bit move around. A little bit move that one.
Backwards?
That one.
Should I
Okay.
just
You have
stand?
your classmate there.
Should I just stand?
No, that's fine. That's fine. Okay. So we're going to do now range of motion of the upper. Okay? So that later on they can help themselves, especially if their dominant side is being affected. So at least they can put something in their mouth, right? Using assistive devices. And we're going to do again the range of motion. That is, I'm going to leave there as a cheat sheet for you. The shoulder we're gonna do for movement. We have the shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction. So let's all pronounce those words. 1, 2, 3, go. Shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction. What about the legs? There, the legs. Knee flexion, knee extension, dorsiflexion, plantar flexion. Yeah, I'm going to do those. So every skills that you're going to do in the state exam, you always start with washing hands. Okay, pretend, you pretend. Okay, let me do now. I wash my hands before I enter the room. Knock, knock. May I come in? Good morning. My name is Anna. I'm your CNA for today. May I check your ID then? Your name is Grace Lee. Mrs. Lee, I'm here to help you to exercise your shoulder. I'm going to close your curtain for your privacy. Lock your bed for safety. Raise your bed to my home. Maybe I can raise this one a little bit.
Oh, yeah.
To look. That's it. Alright. Mrs. Lee, are you in any pain? You stand, you stand shoulder level or a little bit beyond. Okay? If you are tall, a little bit beyond. If you are short like me, at least a little bit just shoulder level beyond. Okay? Left hand on the wrist. Right hand on the elbow. You have to straighten, yeah, the elbow, because don't do like this. Okay, so all is straight because it's the shoulder that we're moving. Again, start shoulder flexion, shoulder extension, shoulder flexion, shoulder extension. Do you feel any pain? Shoulder flexion, shoulder extension. Shoulder abduction, shoulder adduction. Do you feel any pain? Shoulder abduction, shoulder adduction, shoulder abduction, shoulder adduction. You feel any pain? Okay. All right, Mrs. Lee, we are done for today. Put your bed in the lowest position. Here is your collar. See you later. Open the curtain. Wash my hands. Document. Skills complete. Okay? Okay. That is 2 now. 2 skills. So I want you to remember those skills. Then we're going to do now the legs. So that we're going to reinforce all the things that from the rehab have they done to the patient so that the patient can easily get out of the bed and walk. Okay? We're gonna strengthen the muscles of the patient and so that they can move their feet when they walk. Okay? We're gonna strengthen the calf muscle, the back of the leg muscle. Okay? So in the state exam, you only do the right side. You only do the right side. They give you, the state already give you the part of the body that you're going to do. Okay? So for the stroke patient, it's gonna be the right side. So that's why I'm showing you what part of the body that you're going to demonstrate to the examiner on your test days. Okay? Ready? So we're gonna do now the lower extremities. Again, we're going to do. I wash my hands before I enter the room. Knock knock. May I come in? Good morning. My name is Anna. I'm your CNA for today. May I check your ID pad? Your name is Grace Lee. Mrs. Lee, I'm here to help you to exercise your legs. I'm going to close your curtain for your privacy, lock your bed for safety, raise your bed to my comfort. Now I'm going to remove your blanket. Okay. The patient is in gown, right? Okay. One hand on top of here. One hand behind the knee. Get? Okay, good. So you're gonna look at my hand, the one behind the knee. You're gonna relax, okay? So this is knee flexion, knee extension. See my hand? Knee flexion, knee extension. Do you feel any pain? Knee flexion, knee extension. Come in here. You're going to put the heel on your palm. You're going to hold here, not the toes. The toes is going to, you're gonna crack them. Especially this is a stroke patient, right? You're gonna dislocate them or you're gonna crack them. So we're going to go up. Dorsiflexion, plantar flexion. You feel any pain? Can everybody say with that word? 1, 2, 3, go. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Do you feel any pain? All right, Mrs. Lee, we are done for today. Put your bed in the lowest position. I'm going to cover you. Here is your call light. See you later. Open the curtain. Wash my hands. Document. Skills complete. Okay? All right.
Can you show the hand placement? Because I couldn't see. Could you show the hand placement on the leg
Oh,
from this angle?
from the ankle.
I mean, from this angle.
Oh.
So I can see.
Here. This one,
Okay, there.
and then here.
Okay, fantastic. Thank you.
Here and here.
Okay.
Do
Thank
not
you.
go there. Okay? Now we're going to help the patient during mealtime. Okay. All right, mealtime. Patient is going to eat. So, this one is called overbed table. This table is called overbed because you're going to put over the bed onto the patient. This one can be adjusted. So you're not going, how can I do? No, right? So here on the side, there is a handle here. You press up and down. That makes sense? Okay, good. Whenever you go and help the patient during mealtime, you need to sit. You need to find a chair and face the patient. Okay? All right. So here we go. It's another story for this one, for delivering the tray. We're gonna help the patient to eat. Okay? All right. It's no longer Mrs. Lee here. I wash my hands before I pick up the tray. This tray belongs or for Mrs. Grace Brown. Okay. Knock, knock. May I come in? Good morning. My name is Anna. I'm your CNA for today. I'm here to help you with your meal. May I check your ID band? Your name is Grace Brown. Close your curtain for your privacy. Lock your bed for safety and raise your bed to my comfort. Mrs. Lee, I'm going to sit you up 75 to 90 degrees. What's the degree?
75 to 90.
Maybe your examiner, okay, that's it for 90 degrees. Yeah, or 70. Make sure you're going to level with the patient, or you're not going. See this one? This is space, is open space towards the patient. Okay? All right. Your name is Mrs. Grace Brown. Allergies none. Diet regular. Restriction none. All right. Miss Brown, it's either which one goes first, okay? It doesn't matter. I'm going to clean your hands. So one side, one hand. Then the other side for the other hand. Unfold. I'm going to clean your mouth, okay? You're not going to touch the patient, skin or face, okay? Just do it like this, okay? It's far, right? Then, so that is dirty. This is a clean one. So now, Mrs. Lee, I'm going to put this on here. Alright. Mrs. Lee. So, our patient is right paralyzed, right? And the other side is the side of the brain that is being affected. So we're gonna do left. Inside your plate is you have an egg and you have a toast. And I'm going to cut bite size. Okay? Miss Lee. Miss Brown. Which one you're going to start with? Which one to begin? Egg, toast. A toast. You're going into the left side. Okay? Swallow good. One more bite. You swallow good. Water or juice? Okay. Now this is your egg. Okay. So in your state exam, 2 bites. After 2 bites, you're gonna give the fluid. Okay? This is now your egg. Swallowing good. One more bite of your egg. Swallow good. Alright, this is now your water. Here is your water. Alright, you sleep. You swallow good. Alright. You sleep, you ate 100%. Okay? Now I'm going to clean your mouth. And unfold, clean your hand. Alright, Mrs. Lee, do not grab here. This is dirty, right? So you're gonna fold whatever you want to fold. Okay? It doesn't matter. As long as you don't grab into the front. Alright, Mrs. Lee. I'm going to leave you seated for 30 minutes. We are done for today. Lower your bed into the lowest position. So do not leave this one, okay? The same way, do not leave the chair on that side. Put this one. Open the curtain so that you can go out. Okay. Put in the designated area. Solving. There is just put in here. Solving. Yeah. Wash my hands. Document. Skills complete. So I want you to practice 4 skills. Changing gown, range of motion of the upper, range of motion of the lower, and helping the patient with their meal. Is that okay? Okay.
After you finish the food, leave the tray here, close to the bed.
Isn't it at the end?
The tray,
Yeah, at the end. This is the end. There's no tray here now.
not in the back.
I know. No. The tray.
He means the table.
Oh, the table? No, you can put over there. Yeah, but because you,
Oh.
yeah. But at the facility, you always put close to them too. Okay? When a patient is not there, then you're going to put this one, of course, inside. Okay? Is that okay now?
Yeah.
Alrighty. So, maybe we can have a little break. Is that okay? Maybe we can have a break at 10 minutes. Come back at 11. Is that okay?
Yeah.
11. And then